Greetings and welcome to day 2 of IPSSV 2021. We wanted to take the time this morning and recognize the important work of our colleagues and volunteers. First, I would like to invite Dr. Isabel Gross to share about the IPSS Inspire Pediatric Simulation Fellowship Program.
Welcome, good morning, good afternoon, good evening, everybody. My name is Isabel Gross. I'm the chair of the IPSS Inspire Pediatric Simulation Fellowship. I'm going to give you an update today about our progress and our current activities. I'm very excited to be here with you. A special thanks today goes to our leadership, the associate chairs, Kang and Gita. Thank you very much for putting countless hours, creativity, and enthusiasm into the fellowship. I also would like to acknowledge our committee members, Mark Adler, Jonathan Duff, Lou Halamek, Veena Nadkarni, Akira Nishisaki, and Taylor Sawyer. Thank you very much for your commitment. I would like to especially thank and welcome Jabin Fayas. She is joining our committee. Thank you very much for being a wonderful addition with your experience. So what is this fellowship about? This fellowship was created 4 years ago. We now have the 4th cohort of fellows. It has been in the making for many, many years. So thank you for everybody who has been developing the thought around the fellowship for many, many years. Our fellowship is all about mentorship and networking. There is a very strong IPSS and Inspire mentorship pool that we can draw from and help our fellows grow. We are also very proud to offer international experiences through our members who graciously will host fellows and make this experience even more rich. During the COVID-19 pandemic, we have been having challenges with actual flights and visits, but we have been able to have telesimulations, remote simulations, distance simulations, and there we're already hitting on peer mentorship, where the fellows were actually running simulations together. We had one simulation where the learners were in one location, the facilitator was from a different institution, and then the other fellows were performing a meta debrief on the simulation. Very cool. We offer a very, very broad networking experience. Our mentees and fellows are heavily involved in many different societies and activities. And now, since this year, thanks to our anonymous funder, thank you very much, we have research project funding to make sure that their research project gets to a high class level of simulation-based research. I would like to congratulate our outgoing fellows. Thank you very much, Reines, Mohammed, Ibor, and Shobana for making this an amazing experience, not only for you, but also for us. I'm very proud of everything you have done. And now let's hear from the fellows themselves.
Hi everyone at the Inspire meeting. My name is Reines Balmux. I come from Riga, Latvia, and I am one of the outgoing simulation fellows. I work as pediatric intensivist at Children's Hospital in Riga, and I teach medical students and residents at Riga University. I started IPSS Inspire Fellowship because even though I had been using simulation in my classes for several years, I didn't have any formal training in how to deliver those classes. And there's no opportunity to do that training here in Latvia. So this international fellowship suited really well for me. I think the best part of the fellowship was the networking we had with the international faculty, all the talks that were given to us, the opportunities to join the journal clubs and other simulation events. But especially I'm thankful to Dr. Isabel Gross and Dr. Akira Nishisaki, who were my mentors and who exchanged a lot of very valuable ideas with me. In the last year, I have also grown as simulation faculty. I have had a chance to become lead for simulation-based research at the Medical Education and Technology Center at the Riga University. And I have 2 simulation research grants that are going reasonably well given the circumstances. For the incoming fellows, my advice is just ask questions, be active, send emails, get answers, send more emails and get more answers, and you'll be fine. Thank you.
Hi everyone, my name is Mohammed Bayoumi. I'm one of the NICU physicians in Hamad Medical Corporation in Doha, Qatar. I'm leading the neonatal simulation program in our institution for the last 5 years. Joining the Inspire IPSS Pediatric Simulation Fellowship was really a turning point in my career. I have the opportunity to meet and work closely with my international mentor, Dr. Lo Halamik. I heard and met him many times in the previous IPSS meetings, but with the fellowship work, we have worked closely, and he kindly mentored me in a very nice way. Initially, we had one simulation project, which is about endotracheal intubation in interprofessional neonatal emergency simulation workshop versus neonatal simulation program. That was a hands-on simulation workshops, and we aim to see the intubation success rate, timing criteria, and psychomotor skills before and after the workshop. But unfortunately, due to the COVID restrictions, we were not able to complete that. For the meantime, we are waiting to release the restrictions in our country. We have conducted one workshop so far, and we aim for 2 more to analyze our results. So we have started another project, which is a retrospective observational study to see the effect of our neonatal golden hour simulation workshop on the initial temperature of preterm babies in the first hour of life. It was really a very nice journey with Dr. Lo, and the best part of my fellowship is really working with him closely. I would advise and recommend joining this fellowship program for any of the simulationists and pediatricians all over the world. It is really very nice to go for it. It will enhance your research, simulation opportunity and skills. And that was my reason to join it. I just wanted to enhance my simulation research skills and academic simulation teaching. Thank you very much, and all the best for all. Nice to be with you.
I'm Edward Jacob James, pediatric intensive care physician and sim educator from Christian Medical College, Vellore, in the southern part of India. I wanted to do the IPSS Inspire Simulation Fellowship to improve my skills in simulation teaching and research, and to grow as an educator and leader in healthcare simulation. We started the fellowship journey in March 2020 along with COVID-19 pandemic. The pandemic and lockdown restrictions baffled everyone. Thanks to my mentors, collaborators, and IPSS Inspire team for the continued support and guidance. Because of the barriers in in-person simulation during the pandemic, I adapted telesimulation using the remote sim platform concept of ASEP Simbox. This Simbox was upgraded to make it more interactive using the hotkey links. I made about 14 video clips of real patients with sepsis and shock. Videos of children with drowsiness, respiratory distress, prolonged capillary refill time, and intraosseous access, and others were recorded. This modified version of Telesimbox with hotkeys were used to train our pediatric emergency team, including doctors and nurses, in recognition and first-hour management of shock. Data regarding the performance of the team and real patient outcomes before, during, and after the intervention were documented. The intervention being the telesimulation training, and I conducted about 40 such sessions during the intervention period. Outcome analysis shows that the telesimulation training proved to be effective in improving team's performance and real patient outcomes, including shock reversal time. Apart from this project, I was actively involved in all distance simulation webinars conducted by Pedistas India in promoting telesimulation technique in simulation-based teaching and training during the pandemic. I also used telesimulation to train our pediatric emergency and ICU trainees in CRM and communication skills. I had the opportunity to network with many experts from CHOP, Anandberg School of Communication, ASAP Simbox, IPSS Inspire, and Pedistas team. It is nice to have meetings with my co-fellows and interact with them. The best part of my fellowship is learning adaptability during challenging circumstances and also to appreciate the significance of mentoring. Thanks to my mentors, Dr. Vinay Nadkarni and Dr. Gitanjali Ramanchandra. Best wishes to those who aspire to become IPSS Inspire Sim Fellow. Yes, go for it. Certainly this helps you to improve your skills as Sim educator and leader, and thereby you can make a change in improving real patient outcomes. Thanks to the entire IPSS Inspire team for this great opportunity. Thank you.
This is Dr. Shobana, medical physiologist from South India with warm greetings. To get exposed to simulation-based research globally and the SIM community, I took up my IPSS fellowship project so that I could upgrade my medical education, which is my profession. It was mid-2020 when I took up my IPSS project. The COVID was in its peak and most of our simulation center activities were restricted. I was just stuck and was about to step back my project. It was then I had the first meet with my fellows and the IPSS mentors. This gave me a lot of positivity, and I just looked around for clues as to how I will proceed with my project amidst the various restrictions. I saw that the teaching of medical graduates, the physical examination skills, were remote online mode, which is a new venture for all of us. So I thought of redesigning my project with a nod from Isabel and the guidance of my mentors. I was able to do that. We decided to look at the process of remote clinical skills teaching to graduates and also its outcome by both the modes, the synchronous virtual demonstration and asynchronous video demonstration. After a year of intervention, when we looked at the objective outcome of such intervention in terms of learner performance, yes, virtual mode of teaching could give a positive learner performance and outcome, and it was equal by both the modes of teaching. We also got the faculty perspectives and the challenges what they faced. To list few are decreased learner interaction, paucity of chances for feedback and error correction, internet issues, and lack of a structured teaching and assessment modes. Whereas the learners preferred start teaching because of its feasibility and also because of the availability of a resource which was repeatable. Yes, I had a wonderful journey as an IPSS fellow with a lot of knowledge sharing and interaction with my co-fellows, and beyond that, And I would say more than that, I learned what it is to be a leader and what it is to be a mentor, one who gives a ray of hope and confidence to the mentee. And that is what I gained. So with best wishes to the aspiring new fellows and acknowledgement of appreciation to the IPSS team, this is Dr. Shobana here. Thank you.
I now would like to welcome our incoming fellows. It was very, very challenging to select our fellows this year. We had an overwhelming amount of applications. Thank you for everyone from Inspire and IPSS who helped with reviewing these high-class applications. Let's welcome Daniel Oqueda. He's a pediatric intensivist at the Hospital Italiano de Buenos Aires in Argentina. His mentors are going to be Dr. Alan Deutsch and Tara Dowdy. Thank you very much for offering your commitment to help Daniel grow. Next, we would like to welcome Katharina. Katharina is a neonatologist at the Medical University of Vienna, Austria. She will be mentored by myself and Dr. Akira Nishizaki. Welcome, Katharina. Congratulations. Next, we have Vijay. A lot of us already know Vijay. He is a very, very active simulationist, neonatologist at Rainbow Children's Hospital in Hyderabad in India. He will be mentored by Dr. Mark Adler and Dr. Veena Nadkarni. Thank you very much for your commitment supporting Vijay. Mahima is an anesthesiologist at Sir Gangaram Hospital in New Delhi in India. Thank you, Dr. Aaron Callahun and Dr. Nancy Toffel, for serving as Mahima's mentors. Over the years, we have had many fellows from many different countries, so I just played around and made a map so that you can see where everybody was from. So we had Sharon. First, we had Sharon from Dubai, from the United Arab Emirates. We had Suzanne from the United States, Kang from New Zealand, Geeta, Ibor, Vijay and Mahima from India, Reines from Latvia, Mohammed from Qatar, Shobana from Malaysia. She now lives in India. Katharina from Austria, and now Daniel from Argentina. We're very excited to fill the globe with more colors as we progress. Please join us for our networking session during IPSS. It will be today at 12:30 p.m. Eastern Daylight Time and 3:30 p.m. Eastern Daylight Time. So for most of us, this will be today, but for some of us, this will be tomorrow in the sense of Sunday. So just be careful with the time zones. We're very, very excited about seeing this fellowship grow. I hope to see many of you later today. Thank you very much. If you have any questions and would like to contact us, please reach out to either info@inspiresim.org. If you have a more specific question where you would like to reach out to the leadership, please email me directly at isabel.gross@yale.edu. I'm looking forward to hearing from everyone. Have a wonderful conference.
Thank you, Isabel. I wanted to take a moment and recognize our partnership with Inspire. Together, we are laying a foundation for the pediatric simulation community. This has been a multi-year endeavor, and the program continues to build and grow because of the unyielding leadership of Isabel, Geeta, Kang, and all our incredible fellows and mentors. Join them this afternoon during the networking session to learn more about the program, on how to get involved and support our fellows. Now, I would like to send my gratitude to the countless volunteers who make this organization what it is. I want to start with our committees who collectively advance the mission of the society. An enormous thanks to the chairs, co-chairs, and members of these committees. The education co-chairs, David Eckert from Rocky Vista University, and Elaine Nee from Hospital for Sick Children. The fellowship committee co-chairs, Isabel Gross from Yale School of Medicine, Geeta Ramachada from Peta Stars, India, and Kang Hee-gan from Auckland District Health Board. The Finance Committee, chaired by our treasurer, Travis Whitfield from Yale University. The International Development Advocacy Committee, the co-chairs are Rana Sharara Chami from the American University of Beirut and Rebecca Gray from the Red Cross War Memorial Children's Hospital. And the Membership Committee, chaired by Justin Jeffries from the Johns Hopkins University School of Medicine. And last but not least, the WebCAM Committee. chaired by Mohammed Bayoumi from Hamid Medical Corporation and Ed Rivera from San Francisco State University. Please join me in a round of thanks to all of our committees, including the Meeting Organizing Committee, who I introduced yesterday, for their extraordinary work on behalf of the Society. While I'm unable to recognize everybody individually here today, please watch for follow-up articles, recognize those who contribute, and the amazing work they are doing and how you too can get involved. Next, I'd like to extend my thanks to the IPSS Executive Committee for their voluntary, tireless efforts and the hours in advancing the Society matters, rewarded by the knowledge that we all care passionately about pediatric simulation. The President-elect, Taylor Sawyer from Seattle Children's Hospital, the Treasurer, Travis Whitfield from Yale University, the Secretary, Betsy Hunt from Johns Hopkins University School of Medicine, and our past President, Lydia Lofton, Health Education England in London, England. Similarly, the Board of Directors, who have consistently and consciously offered their expertise and wisdom in the consideration of society business over this last year. With the issues facing all of us during this pandemic, IPSS is no different. We need all of you to join us and answer the call for action as leadership works diligently to ensure the organization is solvent and thrives long into the future. Thank you to Ann Ades, the Children's Hospital of Philadelphia, Brittany Dolan from Children's Minnesota, Ellen Deutsch from Children's Hospital of Philadelphia, Kristen Glass from Penn State Health Children's Hospital, Isabel Gross from Yale School of Medicine, Joe Haggerty from Starship Children's Hospital, Justin Jeffries from Johns Hopkins University, Elaine Nee from Hospital for Sick Children, Trish Wood from Auckland District Health Board, and our trainee members, Kang Hee Gang from Auckland District Health Board. I would be remiss if I didn't recognize our ex officios who always collectively pull together and help when needed so we can continue to build on the foundation they established. Their support is unwavering. I also want to acknowledge the work of our amazing IPSS staff team. Justine Barrett, our Digital Marketing Coordinator, Aaron Winholtz, our Senior Association Coordinator, and of course, Monica Evans-Loom, our Executive Director. And to many of the others helping to support this conference and the day-to-day operations of our organization, we thank you. This conference would not be possible without our sponsors and exhibitors. Thank you for your continued support year after year. Be sure to visit their booths and attend the technology demos to hear about their work. We want to recognize and thank you all of our affiliates and patron organizations shown here. These partnerships help extend our networks and cast a broader perspective in the care of our patients. And finally, a recognition to all of you. The Society would not be what it is without your commitment. Please continue to engage and encourage your colleagues and networks to join our community. I thank you all for being here, and I hope you enjoy day 2 of the programming.